Welcome to Toronto Children's Services Infection Prevention and Control Tips and Considerations training module. Infection prevention and control is not new to your programs, whether it is a childcare centre, home childcare, or an early on program. As COVID-19 circulates in our communities, any errors or shortcuts in infection prevention and control can put us all at risk. This training module does not encompass an entire IPAC program, but includes some elements to consider. These are infection prevention and control practices essential to keeping yourself, the children, and everyone around you safe from the spread of COVID-19. Infection prevention and control, also known as IPAC, have various program elements. Some examples of these IPAC program practices are hand hygiene, toy washing, and environmental cleaning. Now is the time to review practices and implement new habits. Together, we can stop the spread of COVID-19. Thorough hand washing and hand sanitizing is your first line of defense against germs and viruses like COVID-19. Wash every time you enter the room, play outdoors, blow your nose, change a diaper, touch garbage, or if you're about to touch food, your face, or anyone else. You should be washing or sanitizing your hands frequently throughout the day. It is an essential practice to keep us all safe. Remember to refer to Toronto Public Health hand hygiene posters and ensure they are posted in your environment. A proper hand washing, which you must do each and every time, takes at least 15 seconds or is about as long as singing happy birthday twice. Hand sanitizing is also a good way to make sure that your hands are clean and free of germs and viruses, including COVID-19. You should wash or sanitize your hands frequently throughout the day. We know that using this essential practice is one of the ways we can all stay safe. Hand hygiene supplies should be monitored to ensure adequate amounts of liquid soap, paper towel, hand sanitizer, tissues, and waste receptacles are lined with plastic bags.
Let's try it together. Start by wetting your hands with water. Apply enough soap to cover all hand surfaces. Rub your hands palm to palm. Now, right palm over the back of your left hand with fingers interlaced and switch. Palm to palm with fingers interlaced this time. Put your fingertips together and rub the back of your fingers into the opposite palm. Rub around your entire left thumb with your right palm and vice versa. Rub the top of your fingertips into your opposite palm on both hands. Rub your wrist with your opposite hand and switch. Rinse your hands off with water. Dry your hands with a paper towel. Use the paper towel to turn off the tap.
Use these simple tips to ensure that you are hand sanitizing properly. Check the alcohol content to make sure it is at least 70% and must be food grade, not technical grade. Make sure your hands are not visibly soiled or sweaty because the sanitizer will not be able to break through to kill viruses. Once these things are in place, you are good to go. First, start by applying the sanitizer. Second, rub your hands together and work sanitizer between each finger, on the back of your hands, on your fingertips, and under your nails. Third, keep working in the sanitizer until your hands feel dry. Now your hands are sanitized. Remember to refer to Toronto Public Health hand sanitizing posters and ensure they are posted in your environment. Let's move on to how to use gloves appropriately. To put on gloves, first wash or sanitize your hands. Second, put a hand in each glove, being careful not to tear or puncture the gloves. Third, like masks, new gloves must be worn each time they are removed. Remember to refer to the Toronto Public Health poster that should be posted in your environment.
Project 3D.
This video shows how to safely remove gloves using the
One has to follow specific
method.
steps when removing used gloves to minimize the chances of cross-infection. Pinch the glove at the wrist level and pull it some distance away from the skin without touching the skin of the forearm. Peel the glove away from the hand, thus allowing it to turn inside out. Hold the removed glove in the gloved hand and slide the fingers of the ungloved hand between the glove and the skin of the wrist. Remove the second glove by rolling it down the hand and folding it over the first glove. Discard the removed gloves in a suitable biohazard waste bag or bin. Perform hand hygiene. Discard the removed gloves in a suitable biohazard waste bag or bin.
Regular environmental cleaning ensures our surfaces are free of germs and viruses, including COVID-19. Environmental cleaning must be done frequently throughout the day. We know that using this essential practice is one of the ways we can all stay safe. There are two ways to clean: cleaning and disinfecting. The following slides outline the difference between the two. Cleaning relates to if a surface is visibly soiled. It needs to be cleaned first and then disinfect. Cleaning removes dirt but does not kill germs. Use these simple tips to ensure that you are cleaning properly. Use detergent and warm water to clean visibly soiled surfaces. Rinse the surface with clean, warm water to ensure detergent is removed, and then let the surface dry. After cleaning, or if the surface appears to be free of dirt, the surface still needs to be disinfected. A solution such as bleach and water, Oxyver, or other appropriate disinfecting solution is used to kill most disease-causing microorganisms. When using a disinfectant, ensure that it is out of reach of children, and when applied to the surface, that area is non-accessible to children. Use these simple tips to ensure that you are disinfecting properly. For general environmental disinfecting, use bleach and water, Oxyver, or another appropriate disinfecting solution. Spray the item that requires disinfecting. The contact time for bleach and water is 2 minutes. This means the solution must remain on the surface for 2 minutes before it is wiped away. After 2 minutes, the surface has been disinfected. If the surface is still wet, you can wipe it dry with a single-use paper towel. Any surface that children come in contact with must have a final rinse with a single-use paper towel, for example, tables and chairs. When disinfecting, it is important to outline which areas are high touch and low touch to ensure frequency of cleaning and disinfecting is maintained. High touch and common areas must be cleaned and disinfected at least twice daily, when visibly dirty and after contact with body fluids. Low touch surfaces must be cleaned and disinfected once daily and as needed. Low touch surfaces are any surfaces at your location that has minimal contact with hands, such as floors, walls, and windowsills. Contact time means that surfaces are visibly wet with the disinfecting solution for the length of time on the product label. Oxiver is 1 minute and bleach is 2 minutes. So for example, the table is cleaned before lunch. The table is sprayed with the water bleach solution and the contact time is 2 minutes. Therefore, the table needs to remain wet for the full contact time before wiping the table dry. Each cleaning product has a different contact time. Check the solution label to confirm the correct contact time is applied when disinfecting to ensure the killing of germs. Now let's look at toy washing. Properly disinfecting toys reduces the spread of germs and viruses like COVID-19 among children and everyone who comes into contact with them. We know that using this essential practice is one of the ways we can all stay safe. Remember to refer to the Toronto Public Health toy cleaning and disinfecting poster and ensure it is posted in your environment. During this time, the following toys need to be removed from the play environment. Plush toys, such as stuffed animals and hand puppets. Porous toys, such as toys that can retain water. Communal sensory play, such as group sand, slime, and water play activities. Let's look at some simple tips for properly washing toys using the dishwasher and with bins or sinks. If using the dishwasher for toy washing, the following method is recommended. First, only use the dishwasher in the kitchen when it is not being used for any other purpose, such as washing dishes, food preparation, and serving. 2. Ensure that toys are placed evenly on the dishwashing racks and they are an appropriate size so that they will not fall into the basin. 3. Load the dishwasher and start the dishwashing cycle on a hot setting. 4. When the cycle is complete, carefully remove the toys. They may be hot or contain hot water. 5. Place the toys on a disinfected surface to air dry. 6. Make sure to leave the kitchen clean and tidy when you're done. The 3 sink or bin method. First, wash in clean water and dish detergent. 2. Rinse with clean water. 3. Prepare bleach solution according to the instructions on the label or in a ratio of 1 teaspoon of bleach per 250 ml of water. 4. Rinse toys to remove bleach residue. 5. Air dry. Disinfectants should have a drug identification number or a DIN. A DIN is an 8-digit number given by Health Canada that confirms it is approved for use in Canada. Alternatively, chlorine bleach solutions may be used for disinfection. Check the expiry date of products you use and always follow manufacturer's instructions on the label, including appropriate personal protective equipment requirements. Refer to Health Canada for a list of approved disinfectants. In this module, we have highlighted some of the key parts of an IPAC program. There are many elements to consider in an IPAC program, such as policies and procedures, immunizations, and signage. Refer to the Toronto Public Health Guidance document for additional information. That concludes the IPAC training module. Please inform your supervisor, director, or home visitor that you have completed this training module. We have provided a list of additional resources for you to access They can be found on the website along with this video.